vaccine. Okay. Hi, Michael. My name's Brandon. I'm your student nurse today.
Thank you.
Thank you for coming in. I
Yeah.
see that you're here to discuss some things about the HIV vaccine. Could you describe any concerns you may be having with that?
Yeah, I guess I'm not really sure what to do about it. I've heard it's pretty new, so I don't know too much about it.
Yeah.
Also heard it's a little bit painful.
Mm-hmm.
Not usually a fan of getting injections and things like that. A little bit worried about that. And then also, you know, I don't know if it's necessarily right for me. I think I have a pretty healthy lifestyle. It doesn't really seem like I'm at risk for it, so I don't know if it's too necessary for me. Yeah.
Okay, that's very understandable. So it sounds like you're reluctant to get it because of the pain. That's kind of an issue, and also you may not think that you're needed for your lifestyle, I guess, in a way.
Yeah.
So could you describe more on what you mean by the pain, like what you've heard about the pain, and also the lifestyle, like what you mean by that you might not be at risk with your lifestyle?
Yeah. So I just heard from a couple people that it's kind of painful upon injection.
Mm-hmm.
It might lead to a little bit of a pain and swelling after that.
Yep.
Usually just not too much of a fan of getting shots like that, especially if it kind of hurts. And then also, I don't know, it just doesn't really seem like I'd be at risk for getting HIV. You know, I think I have a pretty healthy lifestyle. I don't know if I'd really come in contact with people that could be at risk for me, so I just don't really think it'd be necessary for me.
Yeah, okay.
That.
So, like, what do you plan to maybe go into in the future?
I'm thinking of going into medicine or maybe something in healthcare. Yeah.
Gotcha. So, do you think you maybe come into contact with bodily fluids there, I guess? Or like maybe more possible?
Yeah, I guess I didn't think about that too much, but I think that's definitely possible.
So and maybe just be like a good idea to just be safe and rather than sorry in case that you maybe did come into contact with someone.
Yeah. So is that, do you think it would be a good idea for me?
I feel it'd probably be a safer option than not having it in that regard. So.
Okay.
Yeah.
I mean, I guess that gives me a reason why I might want it, but I guess if it's painful, I'm still not so sure if I want to do it.
So if we could do something about the pain, you'd be more willing to get it.
I think so. Yeah, that's kind of the main concern I guess I have now. Yeah.
Gotcha. So something we could do is I believe we could put some lidocaine cream because we'll give it into your deltoid up here. So we put some cream there, and then it'll help kind of numb it during the injection, so you wouldn't feel it as much.
Okay.
Is that something that would be okay to do? Or
I think if we could reduce the pain, I think that's kind of the main thing that's stopping me. So that sounds good.
The lidocaine would be a good option then.
If you think it's best for me and you can reduce the pain, I think I trust your opinion. So
for sure.
Yeah.
Sweet. Okay. So then on a scale of 1 to 10, 1 being not ready, 10 being completely ready, where do you think you're at right about now?
Well, I think you've addressed my concerns, so I'm not too worried. I'd say a 10.
Oh, sweet.
Yeah.
Awesome. That's good. I'm glad to hear that.
Yeah.
So then before I'll give you an injection, I'd like to go over just kind of what the injection entails and stuff about it.
Yeah.
So here's a vaccine sheet just to kind of look over and also run through this PowerPoint with you here. Okay. So we just got the HIV vaccine. So what is it? It's a recombinant vaccine, virus vaccine. It uses HIV proteins and not the actual virus, so it's not a live virus. So you're not going to actually ever have the HIV virus within you. So just to not worry about that. Will not be at risk of getting HIV from this vaccine because of its recombinant virus. And this is an IM injection in the deltoid, kind of what we talked about with, and that's where I'll put the lidocaine cream. So then who can get it? Anyone 18 years of older. So I would imagine you're 20, I saw from the sheet.
Yeah.
Okay, perfect. So what does it do? It provides full protection from HIV. It's successful in 91% of patients that receive all 4 doses. So what that means is you'll receive the first dose today, and then you'll have to come back one time every month until you receive all 4, if that's decent. And then we can provide a test that's done in 6 months to see if you were one of the 91% that got the full protection.
Oh, okay.
Yeah, and if not, then you'll have to just come back and hopefully get all 4 doses again. But we can do the lidocaine cream again and numb it up so it's not painful again.
Okay.
Side effects can be painful on administration, which we kind of addressed. Can produce a fever. If a fever gets over 101, call a doctor, come back to the clinic because that could be severe. Some pain and redness at injection site, and if swelling persists for more than a week, you want to contact a doctor just to make sure things are okay. And a headache, which should subside in 1 day. And then all these are normal side effects.
Okay.
So before I go further, I'd like to kind of have a teach back session. So I'd like you to just for some of the things that I said, I'd like you to just kind of make sure that you understand them. So what is this vaccine for?
Yeah, so it'll be recombinant virus vaccine for getting HIV, and be using the HIV proteins rather than actually putting the disease.
For sure, yeah.
So,
Perfect. And then, that's basically what it does. So then how many doses of this will you need?
So it'd be 4 doses.
Yep, exactly. Some side effects?
So I meant like the pain we mentioned earlier for one, potentially maybe getting a fever after, and then a headache too.
Yep. And then, and then I'll keep going a little bit, and then we got a couple more questions. So then some serious reactions that could happen is if you experience hives, swelling of the face, throat, fast heartbeat, difficulty breathing, you're probably having an allergic reaction, a severe one. So then contact 911 or get to the hospital just to be safe. So then some contraindications. So if you have a severe allergic reaction to HPV vaccine, you shouldn't be getting this vaccine today. But I looked at your medical records and I didn't see that you were allergic to HPV. If you have a severe allergy to any component of HIV virus or HPV virus, then you shouldn't get it because HPV and HIV are very similar in vaccine-wise.
Oh, okay.
Should not get if you are pregnant, which I don't think you are, and it should not get if you are moderately or severely ill. So do you feel healthy today? Or do you
I feel
sick?
healthy, yeah.
Okay, good. Okay, and then just to kind of review those two, could you tell me some about the serious reactions that could come from this disease, or this vaccine, I should say?
Yeah, that's possibly just like an allergic reaction or having not a good response from my body, getting sicker and not feeling good after that.
The hives and swelling.
Yeah,
right?
swelling too.
Maybe difficulty breathing, so
Yeah,
you just want to come back in with that. And then, some of the contraindications, but most of those you didn't qualify for.
I have an allergic reaction to the HPV vaccine, and I'm feeling healthy today, so I think
Awesome. It's good to hear. So we should be good then, I think. You have the sheet, and I'll go get the vaccine, and
yeah.
we'll be right back.
Awesome, thank you.